today is about skin cancer awareness. And as a fellowship trained Mohs surgeon who really half of her day is spent treating skin cancer, I want to get the message out that skin cancer can be and should be highly curable, but that requires you to be looking at your skin, and it requires you to get a skin exam once a year to make sure that an expert is looking at your skin, so if there are changes concerning of skin cancer, they're identified early and treated early so that it's not a long-term problem for you. There are 3 different types of skin cancers that are the most common. The scariest one that you hear about is melanoma. And melanoma presents typically as a blotch or a brown spot that is growing or changing in areas of increased sun exposure. So the risk of developing melanoma is higher if you personally have had a number of blistering sunburns, if you have a family history of melanoma, meaning a mom, a dad, or a sibling has had melanoma, and if you see a brown spot that shows up, it's okay to ignore it for a month. What is not okay is if it's evolving, if it is changing. If a spot shows up and then a month later it looks different, it's really important that you are your own advocate and you go in and get that spot looked at. Worst case scenario, they're going to biopsy it, you'll have additional information, and if you need to have surgery, they will remove that spot with margins to clear it so it never comes back again, and that's what I do. Now, the other 2 forms of skin cancer that are quite common, basal cell are actually the most common in the United States, and the second one is squamous cell. So basal cell is the most common, squamous cell is the second most common, melanoma is the third most common. Melanoma, 1 in 50 people will get. Basal cells is really more like 1 in 4 when you get over the age of 60. Basal cells also develop in areas of increased sun exposure. There's a genetic predisposition for that. Squamous cells, same thing, develop in areas of sun exposure. There's a genetic predisposition. Squamous cells really are associated with chronic long-term sun exposure. They're more common with people who work outside, play a lot of golf. There is also an association with the wart virus with squamous cells. All 3 forms are increased if you are immunocompromised, meaning you're taking medication because of your psoriasis or because you have a transplant, and it affects your immune system, and your immune system is a really important part of checking for those skin cancers. So if you are immunocompromised, that's another reason why you should get regular skin exams. Things that you can do for yourself at home: wear sunscreen every day, avoid long-term direct sun, particularly during the most powerful hours of the day, which is usually 11 until 4 p.m. In addition to that, look at your skin. Once a month, look at your skin. Don't do it more than that because people can fixate, but look at your skin, pay attention to your moles, and then let your provider know if something is changing. Take a picture of it so you can show your provider how it's changing. Right now, in the United States, it is hard to get in with dermatologists. So make your appointments early. When you leave, make an appointment for the following year so that spot is reserved for you so you can get the care you deserve. And then be assured that if you are good about that, if you get a skin exam once a year, your likelihood of dying from skin cancer is almost 0. So that's the most important thing, is being proactive. You can really protect yourself from one of the most common types of cancer. Let me know if you have any questions.